Assalamualaikum everyone, welcome back to this channel. So this is me Arya Vaheed, and in this video we are going to start the topic of inflammatory bowel diseases. So in the previous lecture we have discussed about the anti-emetic drugs and we have completed it. We have discussed about the laxatives and purgatives and our osmotic laxative, and there all the types have been discussed. Now we are going to start the last topic of this chapter, which is the inflammatory bowel diseases, and their drugs will be discussed in the next lecture. So what are the inflammatory bowel diseases? So these are actually not a particular disease. This is a group of various kind of intestinal diseases. So actually this is an inflammatory disease. It's mean some type of inflammation occur inside the intestine, whether it is large intestine, whether it is small intestine. So actually your inflammation is a defensive mechanism which occur against infection, against a microbe, but sometimes this inflammation prolongs. So if this inflammation prolong with a very long period of time, then this inflammation in the inside your intestine will become a disease. Now this inflammation can also be called as idiopathic inflammation. What is mean by idiopathic? So idiopathic means it is an autoimmune disease. So autoimmune disease happens when our own body cells become against and become fighting against our own body cells. So therefore this disease will happen. Now there are some types of inflammatory bowel syndrome. So inflammatory bowel disease and irritable bowel syndrome, these are the one thing, so there is no difference between them. Now here they are the three types. They have no mostly difference in them, but they have a little bit of difference. Like if a patient has more symptoms of constipation, then it will be called as inflammatory bowel syndrome constipation. Constipation can be written as only for the C. Okay, so it will be diagnosis as the patient has more dominant symptoms of constipation. Some patient have inflammatory bowel syndrome with more severe diarrhea, so therefore we will represent them as AIBSD. So it's mean this patient has more symptoms of diarrhea, and some patient has mixed symptoms, that sometimes they feel diarrhea and sometimes they feel constipation in them. So therefore we will say these patients as they are the irritable bowel syndrome mixed, means having both symptoms of constipation as well as the diarrhea. Now there are the two diseases which is placed inside the irritable bowel syndromes. What are these diseases? These are Crohn's disease, and the second disease is ulcerative colitis. So there is a difference between both of these diseases. Now we will discuss them in a detail. Here the difference is written between them. So the first difference is based upon the site of disease, that where is the location of a particular disease. So in case of ulcerative colitis, the inflammation or the sores occur in the mucosal lining of large intestine, and mostly the part of large intestine which is used is the colon. So in the colon, if the in the mucosal lining, if the inflammation happens, then it is called as ulcerative colitis. So you know very well about the layers distribution. You know very well that the innermost layer is the mucosal layer, then we have submucosa, then muscularis layer come, and the lastly there is the tunica adventitia. So the inflammation happens till under it. So it's mean that the sore will happen to this like shape. Okay, so therefore it is called as ulcerative colitis. Now if we move on to the Crohn's disease, can be represented as CD. So this is the inflammation which can be take place anywhere from mouth to your anus, mean this is not have a localized action. In the ulcerative colitis we have seen that only the large intestine is the target, and there is a specific part of large intestine which is colon. But in case of Crohn's disease, the inflammation can happen from your mouth till your anus, can be anywhere. Now, the next difference is based upon the starting point of that disease, that from where this disease is started until which end it will enclose it. So, in case of ulcerative colitis, the last part of your large intestine, which is the rectum, from the rectum, the disease start its progression, and it will progress itself to the colon. And you know very well that colon has specific parts, that if we travel to them from the descending order. So first of all rectum comes, then after the rectum there is a parts of colon. The first part is the sigmoid colon, then there will be descending colon, then there is transfer colon, and then there is ascending colon. So this disease progressively start the inflammation in these parts. So first of all the rectum is a target. Rectum will inflamed, then after that the sigmoid colon will inflame, then descending colon, then transfer colon, and at the last your ascending colon is damaged. So here I am drawing the diagram for it in order to make the full and complete concept in your minds. So here, as you can see here in the diagram, so first of all the disease progress into your rectum, causing the swelling of that rectum. So first of all I am drawing a normal large intestine, then I will change its appearance in order to locate a particular disease in it. So this is our large intestine, which is normally and which is 100% accurate. Okay, now let's suppose this person has started a disease of ulcerative colitis. So first of all the rectum of that particular person will swell up. Now I am increasing the size of that rectum, so its size is going to be swell like that. Okay, now, and now this person rectum is already inflamed. Now there is a the sigmoid colon will be going to swell, and there will be inflammation of it. So this part is called as sigmoid colon. Then this area is called a descending colon, this is the transfer colon, and this is the ascending colon. So this progressively disease travels up and causing the swelling of your large intestine and making it sore in its inner lining. So it's mean if I am zooming up upon the lining of that layer, so what will be happening inside that. So let's suppose this is the whole layer of your intestine. Okay, and now the sores will be formed like that. So these kind of sores will formed and they cause the swelling of your large intestine. Now let's discuss about the in case of Crohn's disease, where the disease starting point. So in the Crohn disease start from a last part of your small intestine. And what is the last part of your small intestine? Yes, it is ileum. So the junction of ileum and cecum of which is the part of large intestine. So the junction between them, here the Crohn disease is occurs, and almost the 80% of patient has this kind of ulcer here. So their large last part of your intestine enclosed in ileum, and ileum has a sphincter of it, and at this area of sphincter this Crohn's disease is formed, and 80% of patients suffer from it. Now let's discuss what is the pattern of your disease, that how it progressively increase their severity. So first of all the ulcerative colitis, it will be decrease, or it will be progress in a continuous manner. Means first of all it will it will inflame your rectum, then after that it will move to the colon, and progressively it is causing the disease. But if you consider a case of Crohn's disease, it is not continuous, it is the patches of inflammation. So first of all let's consider that it first of all it is performing the this here the part of small intestine and this is the ileum, and after that this is the sphincter and this is the cecum part. So first of all the inflammation happens here, so therefore this area will swell up. Now I am increasing the size of this swell, this will occur as this. So as you can see here, this part is going to be swell. Now it is non-progressive, non-continuous, so it's mean this part will be inflamed, then the next part will remain normal, then after that the next part will again flamed and become swallow. So here you can see its size increases. Now the next part again remains same, then the other part will again show some types of swelling or inflammation in it, then again it will remains normal. So this is called as Crohn's disease, which is non-constituent. It is forming the patches of your inflammation. Some patches has inflamed, next part is normal, then there is inflammation, then the next part is normal. So therefore it is non-continuous pattern of inflammation. So now let's see their difference on the base of their sore size. Sore mean the inflammation deepage. Okay. So in case of ulcerative colitis, the ulcer penetrates the inner mucosal layer. So your mucosal layer is the innermost layer. So your sore will be penetrate up to that layer. But if you move towards the Crohn's disease, the ulcer penetrate the whole layer. Means it doesn't confined only to your inner layer. It penetrates into the whole layer and making a deep hole in it. So therefore these kind of deep cuts can also be called as transmural cuts. So it's mean whenever you have Crohn's disease, you will observe transmural cuts, mean the whole layer is going to be forming holes in it and causing the material to flow from one organ to other organ. Now the next difference is on the base of the intestine size. After the disease of ulcerative colitis, you will feel that your intestine dilates, mean the size of your intestine swell up and its size increases. But in case of Crohn's disease, what will happen, the size of your intestine decreases. And also you will observe that in the coronal disease, the thickness of your muscularis layer of your small intestine or your large intestine will be swell up. Okay, and you will feel bubbly like appearance in it. So however you have eat the bubbly chocolate, so it has bubbles in it, so just like the shape of your large intestine will become. So somewhere it will swell up, then it will decrease to normal size, then it swell up. So therefore the bubbles like appearance will you will see in case of Crohn's disease. Now let's discuss their complications, that what kind of complications you will observe in a particular kind of disease. So let's discuss what types of complications occur in a particular disease. So these are the complications of your Crohn's disease, and these are the complication of ulcerative colitis. So in case of ulcerative colitis, you will observe megacolon. So mega word mean big, and colon mean the part of your large intestine. It's mean the size of your colon will be severely increased. Second complication, you will observe that the cancer of colon can happens to that particular patient. Now let's discuss the complication in Crohn's disease. So the first complication is the fistula. So what is mean by fistula? Fistula means the opening from one organ to another organs. What is mean by it? So I am drawing a diagram here in order to tell you that what is a fistula. So this is your normal large intestine. So here you can see that this is a small intestine. Okay, so now what is happen, the deep, due to the deep fissures which happens in the Crohn's disease, what is happen, that there will be opening between these two layers. So these two layers form the hole in it, and due to this hole formation, okay, so I am making a hole in them. So let's suppose there is a hole in this layer, and also there is a hole formation in this. So now the material which is present in the large intestine, it can moves down here and can enter into the small intestine. So this kind of connection between from one organ to another organ, and the transfer of material from one organ to another organ due to the formation of sores and inflammations, these are called as fistula. Now the next is complication is the strictures. Now let's discuss that what are the strictures. So So strictures are the hard scars. So what are the scars? However, you get a cut on your skin. So when you got a cut, then it will reappear itself. So first of all, so for example, I have got a cut here. So as you can see here, it has no normal appearance. It clearly observed that there is a deep fissure. So you have gotten a cut here that represent it a deep cut. So after the deep cut, your tissues will reappear itself, but the cut will be appear, and you can feel that it is not normal. It is quite different from the other skin areas. So this is called as scar. So scars will be happening here because of this hole, and there will be this like appearance. So they enclosed it but forming a this like complex here. So these are called as strictures. Now the scar tissues will also be observed as its complication. Lastly, the obstruction will happens here, which is similar to the restrictions. And lastly is there is the abscesses. So what is abscesses? So abscesses is the formation of pus. So you can clearly see when the pimples form, then there is a pus formation in them. So here similarly, when the inflammation happens in your large intestine or in the last part of your small intestine, here pus formation will happen, which make your Crohn's disease more severe. So these are the some complications of that disease. Now we are going to see what are the diagnosis of these diseases, and we will also discuss their causes. So here I have written some types of diagnosis test for these diseases. So the first, you will examine the patient physically. You will take the history of that patient, and from the history you will observe, and you will from his symptoms you will observe that whether a patient has inflammatory bowel disease or not. The second test, you will take his blood test, and from this blood test you will observe the disease. Then you can do the biopsy or endoscopy of that patient. So what is the process of endoscopy is that you will insert a tube into the patient body from the mouth, and this tube has camera on its one end. So from this camera the doctors observe the inner structure of your large intestine and small intestine, and then he will predict that whether you have a disease or not. Biopsy is the same thing as the endoscopy, just the difference is that in the biopsy they will attach an instrument that take a small amount of tissue of your large intestine, and this tissue will taken it out, and then the doctors observe that tissue, and after that they will predict that this tissue contain the symptoms or contain the symptoms or particular types of sores as they are present in the inflammatory disease. Lastly, you will perform the radiology. You will take the x-ray of that particular patient, and then you will predict it. Now we are going to see what are the causes of your inflammatory bowel disease. So the first cause is the presence of microbes, that various kind of bacteria and viruses are present, and due to these viruses the bowel disease is formed. Second, there are some environmental factors, like your diet is so spicy in nature that it can also cause the inflammatory diseases. Second, the smoking is the one of the major cause of inflammation in the large intestine. Some psychological factors also causing these disease, like stress and emotions. Now we are going to see what are the clinical manifestation or indication of a particular disease. So what is mean by clinical manifestation? So these are some types of indication which you feel after the that particular disease. So you can call clinical manifestations as the symptoms. So here I have written some symptoms of inflammatory bowel disease. You are going to feel abdominal pain. Hematochezia is a process in which you observe your blood to came in your stools. So therefore it usually happens in the ulcerative colitis. Second, you will feel low fever. You will feel very low appetite, and anoxia is a state in which you the patient feel fear from eating the food. because due to the pain which start after eating a meat, therefore the patient become fear of it and he will not take the particular kind of food. So therefore his appetite decreases, his weight suddenly lose out, he will feel fatigue and various tiredness. Arthritis is a inflammation of bones, so this is the autoimmune disease which automatically start with the inflammatory bowel disease. Then he will feel bloating mean he will feel his stomach is full, and lastly the constipation and diarrhea will be observed. Now let's discuss what is the pathophysiology behind your inflammatory bowel disease. So the pathophysiology of your inflammatory bowel disease suggests that there is not a particular kind of reason behind that disease. So the scientists cannot discover a particular kind of reason behind this disease. So there are some types of reasons which we can suggest. The first reason is that there should be alteration in the GIT mortality, so there due to which you are feeling inflammation in it. Secondly, there is a hypersensitivity. So some types of patients feel hypersensitivity in their visceral areas, and due to which the inflammations happen. Third reason is that there is a disturbance in the connection between your enteric nervous system and your central nervous system. And lastly, the fourth reason is the gastroenterous infection, that some types of infections happens due to a bacteria or due to any kind of microbe, and due to which you are feeling the inflammation in your large intestine. Now I have explained the fourth physiopathiology in detail. So here I have drawn a diagram for you. So this is the cell of your gastric system of your large intestine. So this is the epithelial lining of your large intestine, and here these dots represent the bacteria which are present outside. Now inside this cell, the various kind of dendritic cell and antigen representing cells are present. Now what is happened, you know very well, in the large intestine you have a 90% of population of your intestinal bacteria, and they are called as microflora. Why they are called as microflora? Because they present inside your large intestine but not causing a particular kind of disease. So actually they are harmful for us because they are helping in the absorption of vitamin 12, they are providing vitamin K, vitamin B12. So therefore they are beneficial, so we cannot kill them. But sometimes their population increase. Let's suppose the E. coli is a bacteria which is 90% present in your large intestine, but if its population increase, it will become pathogen to you and causing disease. So let's suppose the E. coli population increase. So what will happen? This E. coli will enter into the cell. Dendritic cell is a type of antigen representing cell which will check the pathogenicity of your bacteria. So how it is checking that? Actually it will take a part into the bacterial cell. So whenever the bacterial cell enters, let's suppose this is the bacterial cell which enter inside. Now this dendritic cell will take a part of that bacteria and deposit it on cell. So let's suppose this part of bacteria deposits on this dendritic cell. So here it's happened. Now after this part, the dendritic cell will check the amount of that bacteria and pathogenicity inside that bacteria. Various types of antigen representing cell which are in the surrounding of dendritic cell, they will do the same work. And after detecting that this bacteria is pathogenesis, then they will send signals to your lymphocytes T cells. So lymphocyte T cells are of various types, you know very well. Helper cells, suppressor cells, and various kind of CD4 cells are present inside it. So and then there is the activation of all of these cells. So due to the help of these cells, we send the signals and we cause the inflammation on that particular area due to the release of histamine and due to release of various kind of chemicals from the lymphocyte T cells. So this is the reason, or this is the pathophysiology behind your inflammatory bowel syndrome. But if we have seen and I have taught to you that inflammatory bowel disease is an autoimmune disease, means the body cells became itself dangerous for us. So what will happen that sometimes if there is an autoimmune disease, then your epithelial cells will attach to dendritic cells, and the dendritic cell will assume that they are pathogens and they are the bacteria. Then they will activate lymphocyte cells and they cause the inflammation. So this is the reason behind the autoimmune disease. Now, in the next lecture, we will discuss the treatment of IBD, inflammatory bowel disease. So, we first of all we have to achieve the decrease in the rate of inflammatory bowel disease, and secondly, we have to prevent that disease. So, first of all, the treatment of inflammatory bowel disease is to non-pharmacological treatment. So, what is mean by non-pharmacological treatment? So in the treatment, you will say to your patient what types of food he should take and what type of food he should not take. So what type of food he should not take includes your smoking, your spicy food, your alcohol and oily foods, and your non-steroidal anti-inflammatory drugs also. And what kind of food he should take more omega-3 fatty acids and the diet which is rich in fibers. So the treatment of IBD will be discussed in the next lecture. I hope that you will like this lecture. If you like it, then please press the subscribe button. Also press the like button in order to get the notification of all the video which I have uploaded. So thank you so much for liking this channel and subscribing to this video. Meet you soon in the next lecture. Till up, Allah Hafiz.